Hey, everybody. Thank you so much for joining us again. We're here with Julesy this week. She's going to tell her story. Here we go.
Hi everyone, my name is Julesy Roach and I am 34 years old and I live in the Washington, D.C. area with my husband and two kids. I have a 2.5-year-old daughter named Emmy and a 4-year-old son named Patrick. And I am a mental health therapist. I'm the owner of Cape on Counseling. It's a group of 6 therapists and we all have our own specialties, but my particular specialty is working with chronic illness. Mainly people who have illnesses that are often overlooked and misunderstood, like pineal cysts or Lyme disease or Ehlers-Danlos syndrome, POTS, MCAS disorders. So after going through my own really complicated medical journey for many years, I understood the importance of having a therapist who truly understands this stuff. And an understanding from a personal level, I think, makes a huge difference because the mistreatment, the gaslighting, the isolation, all of it is so traumatic when you're also feeling terrible and fighting for your life. Um, so when you know something deep in your bones is going on and you can't get help, it's a very unique type of emotional torture. So that's when I shifted my practice to mainly working with chronic illness patients. Before I got sick, I was doing general anxiety, depression stuff, but now my main focus is chronic illness.
Well, that's cool.
Very cool.
Yeah, I honestly did not know that that was even a thing anywhere. So good
I
on
didn't know that either when I was going through my own medical journey. I was searching for a therapist who understood these complex illnesses. There's a lot of general chronic illness therapists, but I could not find one that understood these pineal cysts and things like Lyme disease and Ehlers-Danlos syndrome that are just not really believed in the medical
Right.
you. Right,
community.
Right.
right.
And
Yeah.
I didn't need someone to help me go through my physical pain, like not minimizing that. It's horrible, but I could deal with that. What I couldn't deal with was the emotional trauma of not being believed for so many years and not
Right.
being able to get any help and having to basically beg for someone to listen to me. That was the hard part.
Well,
Couldn't
you're doing the
find it.
Lord's work. That's something that would have been, wow,
So helpful
invaluable, very helpful, I
if we
think.
had had it on our side for
Yeah.
both of us.
For definitely both of
I
us.
would
Yeah.
imagine you have spouses taking advantage of that as well, because, you know,
Yes.
from my side, going into a doctor's office and them looking at me like I'm trying to get my wife to get drugs for me or something.
Yes.
Yeah.
Yeah. Exactly. And then
Oh,
you start to gaslight yourself when you're repeatedly told over and over again, nothing's wrong with you, or this is anxiety or depression. You're like, okay, is
You
it?
might give up. Yeah, you might give up
Yeah.
on continuing for help. Yeah, it's
it is
awful.
incredibly difficult. Yep.
So I
So
But
love
what's
that you're doing
interesting
that.
is I go back, years and years and years ago, 10, 15 years ago, when I did have depression. When I went off to college, it was a very hard transition for me. And I was clinically depressed. And I went to a therapist and psychiatrist, and they gave me the diagnosis. And I'm like, that's great. Like that fits. That makes sense. I didn't fight it. I wasn't ashamed. So I think when most people get slapped with a psychosomatic diagnosis, when it's really the cyst, they're so upset, not because they're ashamed if it is anxiety or depression, because they know it's not. It doesn't make
Hmm.
sense.
Right.
Um, anyway, so let me get into a little bit about my medical journey, how I got diagnosed, when symptoms started. Looking back, now that I know more about the cyst and the function of the pineal gland, I do think I was probably born with the cyst and my symptoms started when I was an infant. No way of knowing that. Obviously, I didn't get an MRI that young, but from what my mom and grandma told me, as a 6-week old, I was already sleeping 14 hours straight and I was very difficult to wake up. And I remember that being concerning. I remember them telling me that was very concerning for them.
right.
As a kid, I never wanted to get up on Christmas morning.
Oh,
School was
wow.
always really hard. My whole life revolved around when I could nap. I would skip school in high school just to nap in my car, not to go do anything fun. At my jobs, I would, on my lunch break, go sleep in the car. So fatigue was definitely my first and worst symptom for a while. And then it wasn't until I was about 20 that I started getting migraines, or what they thought were migraines. Now I know it was in relation to the cyst, but the migraines were so debilitating where I would land in the ER, just desperate for any type of pain relief.
Mhm.
But those would only happen every few months. I mean, it wasn't ruining my life or anything. I never got an MRI because of it. I was just like, okay, I have migraines. Um, and then when I was about 27 years old, so this is now eight-ish years ago, I got diagnosed with Lyme disease. And this is my theory, but I think the Lyme and the treatment for Lyme swelled my brain and put pressure on the cyst because when I got the Lyme, the headaches became so unbearable. I mean, 24/7, I was wearing an ice pack. I was losing my vision. I had to stop driving. The cognitive issues were really bad. The word recall, I couldn't remember names. I'd be in the grocery store, forget what I was looking for. Um, and that's when I was like, all right, something's going on. And I remember I had an MRI for another issue years ago, and they noted on the report, an incidental finding of a pineal cyst.
Mhm.
That same story that everyone else has.
Right.
Didn't think anything of it. I wasn't referred to neurology or neurosurgery or anything like that. But I was so desperate for answers. I was going through all my old records from years ago, and I saw that. And I'm like, that's never been looked into. And so that's when I went on Facebook and I joined the Pineal Cyst group and I searched for all of the doctors that were commonly talked about. And I made an appointment with, is it okay to name names?
Yes, if you
It's up
would
to
like.
you.
Yeah,
This is your episode.
it is okay though.
um, I made an appointment with Dr. Kim in Houston, who is no longer practicing,
Right.
Hmm.
and Dr. Zwagerman in Wisconsin.
Hmm.
Both wonderful appointments. They agreed my symptoms were coming from the cyst. They both recommended surgery. But my family wasn't totally on board. My husband, my parents, they were just like, this is a really risky surgery. Yeah, they just didn't feel right about it. So they wanted me, of course, to go to like the Mayo Clinic, which I knew I would get no help going there. They wanted me to see a surgeon that didn't specialize in these cysts to get a more objective opinion.
Hmm.
And I reluctantly agreed to please them, but I knew they were not going to be of any help. If not, would do more harm emotionally for me. But I did. I saw a few local neurosurgeons, and I remember one looking my mom in the eye and said, if this is my daughter, I would never let her have the surgery. Do not do this to your daughter. And I just left there crying. I stormed out of the room crying. My mom's probably in tears, like, what do we do? And when I calmed down, we just had a long conversation and I was like, this is it. I know in my bones, this is it.
Hmm.
And so we booked with Dr. Kim a few months later. And the second I woke up from surgery, I remember FaceTiming my mom and my husband saying, I don't have the headache anymore. The headache that had been debilitating me in bed 24/7, it was gone. Of course, I had the surgery pain from the incision, all that normal stuff, but that pressure, that golf ball that I felt sitting on my brainstem was
Hmm.
gone. And to this day, 5 years later, every single symptom, 100% has resolved. I don't have one lingering symptom. I didn't have any even side effects. Some people get some temporary vision loss or
Hmm.
cognitive issues or nausea, nothing. I had the most miraculous recovery. And that's why I'm so happy you guys are doing this podcast because these are so misunderstood, as you know.
Hmm.
And probably a ton are incidental
Yeah.
Yeah.
and don't cause symptoms, but
Right.
some do.
Yep.
And we have to look at them if everything else has been ruled out.
Yeah.
I remember being at a point where I was like Googling physician assisted suicide in Europe or in other countries because I was just I couldn't live with the pain. I mean, it's just not a
Hmm.
type of pain you can live with.
And that people don't understand that, but every person that's had this surgery and those headaches, we all understand it. It's not a regular migraine. It's not a normal, it doesn't respond to normal medications. It's a
Yes, exactly.
completely different kind of pain and a completely different kind of pressure. And it is, sad to say that you and others have told us the same thing, that they would rather not be alive than to not get help with it. They couldn't imagine continuing on like that forever.
Yes. And I
Yeah.
remember Dr. Zwagerman, the neurosurgeon in Wisconsin, I believe, him telling me this is a risky procedure. I mean, we're going to the center of your brain.
Yeah.
You have to be okay with a negative outcome, whatever that may look like. Paralysis, stroke, death. So are you debilitated enough? Are you impaired enough where those potentially devastating or permanent outcomes is worth it? I was like, yes. It was the easiest yes I've ever said. So that's, I think some people aren't as debilitated by these cysts, kind of
Right.
like how I was for about 10 years, a headache every few months. That would have been a hard no. Like this is not worth the risk. But when you do get to the point that a lot of us get to, we just don't have an option.
Right.
Yeah, and it's so individual. We actually had an interview with a mom whose twin daughters both had cystic enlargement of their pineal glands, and one of them opted for the surgery and the other one did not.
Because one of them's
One of them was
life was
that bad, and
being,
the other one
one of them is
didn't
able
feel
to
like
go
they
to
were.
school,
Yeah.
and she doesn't
So
feel, yeah, she
it's
doesn't
a very individualized thing.
absolutely, yeah. Some of them do cause horrific symptoms, and fortunately some don't. And I think too, you have to kind of look at, how did you even come to find out about it? If it's something that just showed up as an incidental finding when you went in for something completely different, I can see how, you might want to do some more digging on that. For the majority of people that have had the surgery, their symptoms all stemmed from their pineal cyst. And so it made sense that everything else that had been, everything had been ruled out. It made sense that it had to be, we ruled everything else out. The only thing left is this.
Exactly.
And that's how it has been for 99.9% of people that have had the surgery.
And people are their own experts. I
Yeah, you know
remember
your body. Yeah.
you know your
Yeah.
body and you know what makes sense. And I remember when I first learned about this cyst, I was in the ER for something unrelated, something with my legs, and they just wanted to do a brain MRI to rule everything out. And that's when I was first told actually about this cyst. And they're like, this is incidental, this is not in relation to what's going on with your legs. And I was like, cool, yeah. That did not make any sense. I didn't feel like I needed to dig into it deeper. And it wasn't until 3 or 4 years later where I went back to that because I had these new symptoms.
Mm-hmm.
So I just think people know their body's best and they have really strong gut instincts.
Right.
I think that for me, I've thought this to myself a few times, that I would not want to get a head MRI for something else right now, because I would
Right.
not want to see an incidental finding of a cystic
Mm-hmm.
enlargement of my pineal gland, because
Mm-hmm.
I've seen what that looks like if it decides to well, activate. Let's use the word activate. If
Mm-hmm.
it decides to go down that path, and whether it's uh, what Dr. Patel says, that it's generating those chemicals that are a little bit off,
Mm-hmm.
or if it's what Dr. Teo says, that it's just about the pressure. Either way, we know what the outcome of that is, and
Right.
that's terrifying.
Right. And they can become symptomatic,
Yeah.
which is
And
the
see,
scary part.
when they first did my MRI, they thought maybe I had multiple sclerosis
Yeah.
because of the symptoms I was having, the
Or Lyme
headaches.
disease
But
They
was
did
one of your
mention
early
Lyme
yeah.
disease. They
diagnoses.
did
Yep.
Yeah.
test me for that, and
Yeah.
that
Mm-hmm.
did come back. Everything was fine, but the seizure-like activity that I was having and the headaches made them think, let's get this brain MRI.
Mm-hmm.
Um, yeah, it's so I'm just curious, how long between I know you're not sure how long you had yours, and possibly you think that there's possibility you've had it all your life. How long between when you first really started having the life disrupting symptoms, the headache,
Mm-hmm.
and then you finally did get a Dr. Kim, to agree that this could be that and it could be the surgery? How long were you in limbo there?
Yeah, I remember it was January 2020 that I woke up one day and I had the most excruciating pressure headache of my life. And that never went away, not even for a minute, until I got the surgery December 30th of that same year.
Mm,
So
okay.
I feel like I was actually pretty lucky that it was only 11 months. I know that sounds long to some people, but I hear stories of years.
Yeah.
Ye- And I cannot imagine, because those 11 and a half months were enough, like I said, to make me Google physician's assistant suicide. So I just kept, I feel so bad for the people that go years and years.
Mhm.
Yeah, I I'm trying to figure out how to phrase this. Okay, so you've mentioned physician-assisted suicide a couple of
Hmm.
times,
Hmm.
and we had one, our most recent episode that aired before the recording that we're doing right now. She very freely spoke of that sort of thing as well, and
Hmm.
she says she was made to feel free to talk about that based on the openness that other people have shown in the podcast that she normally would not have done that.
Hmm.
And I'm curious if
Hmm.
that had an effect on the manner in which you're portraying this now. Does that,
Hmm.
does that make sense?
I haven't listened to any of the other podcasts.
So it doesn't. Okay, good.
So no, I'm open about it because it's real. It's so,
Yeah.
these cysts, not for everyone, but for some, can be so debilitating that
Mhm.
it feels like life cannot go on. Like you cannot go another day with that type of pain. And so people become desperate, you know, to do anything.
I'm very glad to hear that because while I appreciated how kind and generous she was regarding the podcast and how much it meant to her, I don't want it's
Mm.
Heisenberg. You
You
know,
don't want to
once you study it,
influence
it
people's
changes. We
stories. You want
don't
to make
want to
sure
influence.
that,
Exactly.
yeah.
Yes,
Yeah.
we don't want to
Which
be
I
that
don't think it
influence.
influenced her feeling on the matter. I think it influenced her feeling of openness on
Right.
being real on the, so
Yeah.
that
Okay.
was okay. But yeah, no, and it really, so probably 11 months into it for me, I was not having the real bad episodes until probably about a full year from first starting to look for help. And so after that first year, things really got bad. And since you didn't get a chance to hear mine yet, mine, the psychological delusions I had along with the headaches
Hmm.
became not just uh, hurtful to my family, but just they became dangerous. I started doing things that made zero sense. I mean,
Hmm.
to this day, I don't remember them all. I can remember kind of some of the after effects. There was a time I walked out in the middle of the night with bare feet in our country town for a couple of miles. We don't really know how long. And I didn't know why my feet were all torn up the next day. But at that point, I was feeling the same thing. I wasn't, and I didn't really tell doctors because I wasn't depressed. It wasn't a matter
Right.
of I'm too sad or I'm
Exactly.
too sad to be on this earth anymore. It was I
Exactly.
can't, I am suffering and so is my family. And
Right.
I don't have the energy anymore to continue if nobody's going to help me. That
Mhm.
was, it was more of a feeling of almost hopelessness, not sadness. It was,
Exactly. And that's what
yeah.
I hear from most of my patients. They are not depressed. They are
Right.
not sad. They are not suicidal. They want to live. They would not be fighting this hard for an answer, traveling
Right.
around the world, country to different doctors if they didn't want to live. They do. They're desperate to.
And brain surgery is a major thing. Nobody is a healthy person is not going to be desperate to get somebody to go into their brain and take something out. It is a major surgery with a major there are major complications that can happen, and it's a major recovery. And like you said, people traveling across the world. We had a lady on the podcast from Canada who sold her business. She
Sold her medical
a
practice.
medical practice, a dental practice, or
Hmm.
I
To
think that's what it
travel
was.
here
To
to get,
travel
To
to
pay
South
out of pocket
Carolina.
for Dr.
Yep.
Patel to
Yeah,
do the
wow.
because,
surgery.
you
Yeah.
know, it's not like insurance is going to cover over here and
Mhm.
that just
Yeah.
should that just tells you who's going to do that. You're not going to give up your livelihood and
Exactly.
um, spend all this money.
And I think what's also really misunderstood is the neuropsych manifestations of having a cyst in your brain. It can look like anxiety or panic
Right.
disorders or hallucinations or delusions because there's something in your brain pressing against its structures. I mean, of course, that's going to affect our emotions and cause
Mhm.
emotional lability, which just feeds these doctors' narrative, actually, that it's a psych, a psych
Right.
issue.
Right. Yeah. Yep.
But it can cause all of those emotional disturbances. Um, and it's scary. It's really scary for the patient going through it, the family members, the friends, and I think they get fed up. I remember my mom very gently saying, "Is there something really traumatic that happened in college that you're not telling us about? That's, maybe emotional trauma is the root of this." And I'm like, "No, mom, no."
No,
But
mom. Yeah.
it's
They're
people
trying to make sense
they're
of it
they're trying to
too.
make
Yeah.
sense and find an
Yeah.
answer, and we've ruled everything else out. And it's just hard to keep fighting over and over again and convince people that there is something wrong when you don't feel good yourself. You don't have the energy to do that.
All right. You know, speaking of moms, that reminds me, and I don't think we said this on the podcast. My mom actually went to one appointment with me, to the PCP appointment,
Mhm.
because it was almost like she didn't think that we were telling the doctor everything because she kept seeing how I was in between. And we're like, yes, the doctor knows everything, but nobody knows what to do. And they're trying their best. And it was almost like she put her foot down, like, well, I'm going to go to this doctor appointment and make sure that and she saw that, you know, Michael and I were very forthcoming. And she basically just sat there quiet most of the time. And I think it helped her, though, to go because she was getting frustrated in between doctor visits. Like, why is my daughter getting worse, not better?
Mhm.
Almost like maybe she thought we were withholding information, or maybe she thought the doctor was doing something wrong. I don't know. But
Mhm.
she did go with us that one time. And I think that helped her to kind of see what we've been going through for months and months and
Or
months
that
at that
good for
point.
nothing husband of yours just isn't doing his job.
Yeah, and I mean, I don't think I think it was more of like she's trying to make sense of why is she not getting better? Why,
Right.
why is this still going on? Why does she still not have help? But
I,
it is so misunderstood, and there's not enough awareness out there. And our hope is that one day when people do come in with symptomatic pineal cysts, that the neurologist or the doctor before them looks at them and says, don't know if this is what's causing it, but these can and do absolutely cause debilitating symptoms. So let's try to figure it out. That's what we want the narrative to change. Because right now, people go in and they are told unequivocally, it's not that.
Mhm.
That is not causing your symptoms. And
Right.
it's the way that they were taught.
Yes,
And
exactly.
so we can't, we try to say, I don't necessarily blame the doctors because of course we, we don't want them doing something that they don't understand, but
Mhm.
the education on these needs to change. And we do have good doctors like, um, well, Dr. Kim's not in it anymore, but Dr. Patel, we do have doctors that are educating as much as they can and going to these conferences and things. And yeah, we need that to change.
and
And
Musk is a learning hospital, so that
they
he
are,
is
yeah,
actually teaching the next generation, which
right.
is
Yeah.
excellent. And I just want to double back. I love my mother-in-law. She's very cool. And that was a joke earlier, just to be clear.
She listens to this
She does
podcast.
listen to this
Oh,
She
podcast.
does. Hi, mom. Like, I was just trying to like that. I'm sure mom was confused about like, why
Mhm.
is she not getting better? Because,
Yeah,
especially for some of the things that Michael told me that I was doing. I mean, she's getting messages from me that make no sense.
right.
I'm texting her things that make no sense. She's worried and I think that helped her to just kind of be there firsthand and see that
absolutely.
Mhm.
everything that can be done is being done. And it took a long time to finally reach the right people, but we got there eventually.
When I first learned about your podcast. I was so thrilled because no one else is doing this yet. And you're right. Education is so important. And I truly do believe now that I'm on the other side of this and I'm not so emotionally attached, I
Mhm.
do think doctors are doing their best. They know what
Right.
they know and they don't know what they don't know. And they were trained, they were told these do not cause symptoms.
Right.
I really do think the doctor who looked my mom in the eye and said, if this was my daughter, I would never let it happen, truly believed it would have been a huge mistake. Don't cut into the center of your daughter's brain. He was trying to help me. He was just
Right.
educated.
Yeah.
I think because I was so sick and the emotional ability, I was angry. And I went home and I typed up this whole long, angry email that I wanted to send to the head department, which I did not do. And I hear that all the time, that it's just emotionally devastating. And I get that
Mhm.
because it feels like now your life is over. You wait 3 months for this appointment, all your eggs
Right.
are in this basket. They say no, and it's like, okay, what now?
Mhm.
But I wish I could go back and tell myself or tell people at the start of this journey, if you don't get that answer, he's not your guy.
Right.
Right.
Go to the next. Don't use the very little energy that you do have ruminating and being angry. Just that was his opinion. You take it or leave it. And I wish I, in that moment or in those years, had that mindset. But it's hard when you feel like your life
Yeah.
depends on it.
It is when you're spiraling and you're just grasping at anything. Every time you
Yeah.
grab onto something thinking that's going to save you and it doesn't,
Yeah.
it kind of gets more and more difficult the more of that you go through.
And a couple of these doctors have changed their mindsets
Hmm.
after their patients who they told, don't you dare get this, don't get this surgery. It's not going to do anything. And then they see their patient um, and they
Yes.
cannot believe the 180 change.
Mhm.
It is making them rethink things. It is making them look deeper into these. And I think that's great. The people that are okay with, I get if you don't ever want to go talk to that doctor again. That makes sense to me.
I want to say episode 3, Dina, I need to send her a message because she had a mic drop moment. She went back, she made an appointment
She's one of the
and
ones I'm thinking of. I
went
just
back to
didn't
the
remember. I didn't want to
neurosurgeon.
say her name because I
Well,
didn't want to
she's
get her
already in
name
the
wrong.
podcast, so I think that's
Well,
okay.
I didn't, yeah, but I didn't want to get her name wrong on the
Oh,
podcast.
okay.
I knew that she's one of the ones. There was somebody
Yeah.
else too.
So
I
Dina
know.
went back into and had him review, and he's looking and he's getting more and more confused. And she says, "Well, if you're looking for my pineal
It's
gland, it's
not
not there,
there.
and I'm better." And mic drop, walk
Yeah.
out, sort of thing. But
And
Right.
I
she
think
offered
it
to
would
give
be
him the research.
helpful.
Yeah.
I think it would be really helpful for patients after the surgery if they do recover and symptoms resolve to send an educational email or make an appointment. We don't
Yes.
have to approach it with hostility, but
Well,
education.
and that's what Jared, who is the PA for
Dr.
Dr.
Patel.
Patel,
Mhm.
encouraged the listeners to do that. To just,
Mhm.
he said
Maybe,
everybody's doing the best they can. They just don't know. Help them
Yes.
to know and send them the information.
I thought his point of view was really interesting. I don't know if this part was on the podcast. I think this is after we were finished recording. We did talk to Dr. Jared. He does not want to be called doctor. He's a PA, but we did talk to Jared for a little while after the episode was done recording. And
Mhm.
he talked about how for him and even for Dr. Patel, patient accounts for him and patient anecdotes are more educational than anything
Yeah.
else that he
Mhm.
could think of. He can have all the education in the world, but just working hands-on and practicing medicine and then following up. And so that's why he does encourage those people to, don't go in there hostile because he does believe like we do that they're just going off of the information that they know. That's all they know. And so but having those patients come back, seeing their success is going to get them to hopefully see the next patient that walks in with these symptoms in a different light, maybe help that person get help sooner.
Mhm.
um,
Yes.
because we're sitting here going, 11 months seems really fast. That shouldn't be. It shouldn't take anybody 11 months.
Fun.
to get help
Right.
for
It's
a
sad
medical help.
actually that when I said 11 months, I
We're
was,
thinking how fast that is.
yes,
Right. It is
exactly, that
sad.
I'm one of the lucky ones.
Yeah.
Yeah. And honestly, what was for me about 3 years, there are people it took 5, 8, 9, and I'm thinking,
Decade
wow,
plus.
3 years to me felt
Yeah,
ridiculously long. And so that's another thing that we just thought, I just remember thinking, how can this be in 2025 that there is something clearly in our minds, it was clear what was causing, because we know, ourselves and your family knows you and stuff. How in 2025 is it this difficult to get actual real help? Why is it
mhm,
taking this long? That was just that's unacceptable. It's
I know,
unacceptable. And we really, really thank you and everybody else that has come to talk to us, because it's getting out there. It's still quite new as far as the podcast world goes, but every single listen, every single share, more and more people are hearing it. And we know that there are people listening that may be working in the healthcare field. Maybe they're not a doctor and they don't have a lot of authority, but they might be a nurse or some other practitioner that can go, hey, doc, listen to these patients. What do you think? What is your opinion?
exactly.
Um,
And I love what you said about going back to your doctor after surgery and after you're recovered so they can see you. It's different getting an email, like I'm so much better. But when they can lay their eyes on you and see objective differences. I remember right before my surgery, my whole body was affected. My liver was inflamed, my spleen, my reflexes and my legs were all over the place. I had foot clonus. I was affected head to toe. And then when I went in there a few weeks after, my spleen and liver were no longer inflamed. My reflexes were back to normal. My eyesight was back to normal. My doctor's mouth dropped. And he just said he has never in his career seen something like this.
mm, wow.
That's awesome.
Mm-hmm.
We need a lot more of that. Um, in Kelly's case, there are so many that just don't know, because we were all over the place. We drove
We were at the Mayo
to
Clinic for a couple of
Mayo Clinic for two
weeks.
weeks.
Yeah.
We drove to South Carolina 3 times. We were down to MD Anderson in Houston. We're up in the Metroplex for the Brain and Spine Center. Just all over the place. And there's no way for us to go back and they wouldn't remember us anyway, probably.
Yeah.
Well, I think the
But
Mayo Clinic probably would, because
well,
they
yeah,
did
because you spent so much
discuss
time out there.
yeah, we
Yeah.
were there for a couple of weeks and the tumor board did meet to discuss my case. The whole reason why we actually went there is because we had a neurosurgeon look at my MRIs, and he actually called us and we did a video appointment before we went out there, and he told us he could do the surgery. He did believe that he didn't
Okay.
believe all the symptoms I had were being caused, but he
Mhm.
did believe that some of them were enough to where surgery was warranted. But he
Oh,
wanted to do tests first because he wasn't 100% sure the way that mine looked. He wanted to make sure he didn't see anything malignant in like my spine fluid and stuff like that. And so we did go down for a couple of weeks, and we were excited because this is the first doctor that's telling us he
they can
might be able
help.
to help us.
Yes.
And we were there for a couple of weeks. We go home. He's like, listen, we'll give you a call after we meet with the tumor board. And that's all we're waiting on. And we're thinking, well, if this neurosurgeon says he can do it at the Mayo Clinic, we just assumed the tumor board's going to say yes.
Mhm.
And that was
That was devastating.
that was
That
devastating,
was
and we
very
should not
rough.
have assumed. And they deemed it too risky because you're going in the middle of someone's brain, and they didn't think, because I'm not going to just drop dead tomorrow. It's
Mhm.
it was too risky to do, and that was incredibly devastating. And he was super nice. This was a great doctor, and he apologized. He understood what to that point what we had been going through. He understood the expense it was to go get a hotel for a couple of weeks, to go get all these very expensive tests done. And then
Right.
for him to have to call and tell us no,
That
I
was
know
crazy.
I know he didn't want to go to work that day. He was not
Yeah.
looking forward to calling and telling this family who was so excited,
Oh,
sorry,
that was just
Yeah.
probably beyond crushing.
If
it was, yeah.
along those lines, I'm not pushing you to listen to the podcast, but if you decide to listen to an episode, look for Paxton. That's our
Okay.
son, and he does. It's not a terribly long one, but his insights from that when he was a little kid. He's
Oh.
14 now,
3 years.
full-blown teenager. Oh my
So
gosh!
I went from him
But
being 10 to like 13 in the blink of an eye because
yeah, yeah.
don't
Kelly
remember
missed a
long.
bunch of his back when he was still a good kid. I'm joking. He's in the room with us. That's why I just said that. All right.
Great podcast, though. It's the perspective of your
Yes.
son and what it was like to have a very sick mother,
Hmm.
the impact on the whole family.
Yes. I think it was excellent. That's anyway, uh, not to self-promote too much, but I really hope people listen to that one.
Kelly,
Anything
don't
else
mind
that
me asking, who did your surgery?
Dr. Patel at Musk?
Okay, yeah.
Yeah.
I've
And in
seen
fact,
him for another issue, not for he had too long of a wait list when I was getting
yeah.
consult
So
for the cyst, but he's great.
That's awesome.
we ended up getting really lucky when so I found him through a friend who had sent me some articles. I mean, I had people trying to help me find a doctor left and right, and we were Googling some stuff, and she found this article and sent it to me. And I mean, I think I let it sit there for a week or so before I really paid attention to it because I just thought it's going to be another thing that's not going to help me. But I read the article and then I watched his he had this short video attached where he was describing this female who was around my age, who in she had been a CEO, she had 5 kids, she was, young, energetic, who went from that person to not being able to take care of herself really. And every single symptom that she had, my jaw dropped. I just thought, oh my God, this guy has done it before. And he believes that everything was caused, he had a hunch, or at least his medical student had a hunch, and nothing else they had tried had helped her. And they just said, well, what if this surgery helps her? And patient zero is why more and more surgeons are doing this. So I have to thank that lady. I don't know her name, but that's when we called. And I don't know why. I don't remember what the reason was, but we got really lucky because we had a fairly quick, as far as waiting time goes. I think most people are now waiting, 6 months sometimes to get in
It
to
was
see
a
him.
long time.
I
We had
don't
to
know
wait.
what happened. I think we had already called a couple of times, and I think Michael was telling the lady how desperate we were.
It wasn't just that. It's that I had gotten onto his patient roster. I had gotten you onto his patient roster.
At some
And
point.
then we got the invitation to go out to Mayo Clinic. So I had canceled an appointment.
Okay.
But
Oh,
since we
okay.
were already on the patient roster, we
I
didn't have
see.
to re-wait for those initial few months. We spent the time waiting, going out to Mayo Clinic, came back, got the bad news, restarted with them. And so it was like a month later, we got in with Jared. And then the surgery was a couple of months after that.
Literally just like 8 weeks after that, I think, is when we went down for the surgery. And I
Time is weird, so I cannot quote you exactly how long
want to
any of
say
those
it was
waits
about
were.
8 weeks because I think, let's see, August, September. Yeah, about 8 weeks because I think our last appointment was in August. And I only know this because I have some notes that I wrote down that just show that I went to the doctor in August. And then my surgery date was October 2nd.
Right.
And I left that appointment bawling, just so relieved, just couldn't believe that finally.
Yes.
And we didn't even have to do a whole lot of explaining ourselves, which was wild. We would start telling our story and he's nodding along going, yeah. And then this happened. And we're like, yeah. And he's like,
Right.
and
They're
then you
telling the
felt
story for you
this.
almost.
Right.
Yeah. And we're like, yeah.
And when we did the podcast with him and with Dr. Patel, he explained why. He said that, he doesn't want the patient to come in and have to lay it all out like they've done for
Like they've
100
been
other
doing.
doctors. He wants to lay it out and ask if that matches because that reassures them and helps them understand that,
It also
they're in
helps
good
him
hands.
understand if they're a good candidate
Right.
for that surgery. And it was just such a serendipitous, everything lined up. It
was
made
great.
so much sense. And we just thought, that's what's missing is education, because Dr. Patel, he gets 2-3 emails probably daily, I think is what he said, from people around the world looking for
Believe
help.
it. Yeah.
And he cannot answer them all. And that's why his wait time is so long, because there are so many that don't understand these or don't believe that they cause symptoms because of how they were taught. And so I'm sure that he would love to have some more colleagues dispersed throughout the United States and the world that understand these and can do them, and that's why he's so backed up, is because he does understand them, and he does have such a wonderful success rate on these. So
And what's so amazing, and I hear this almost consistently with all of my patients, when they get the cyst removed, even in the hospital, they feel an immediate difference. I don't know if you experience that, but I, like I said
absolutely.
earlier, remember feeling that way. Like, I'm cured. I knew I was cured the moment I woke up from anesthesia.
Yep.
And I think Patel has talked about that as well, that it's this instant,
Yes. Yeah.
which is just wild to me.
I know exactly what you're talking about. Even when you're in tons and tons and tons of pain because you just had brain surgery, it's painful, but it's a different kind of pain.
That's what I
And
said.
it's almost like this veil was lifted off of me when I woke up. Like,
Yeah.
I knew that I still had like this recovery process to go through. I knew that it would probably take some time. But at the same time, something had definitely changed. Our son noticed it right away. One of the things that the cyst did to me, and this is why, I tend to lean towards what Patel believes about it releasing chemicals. Well, we know for sure that it does release something similar to melatonin because he has isolated that. But he believes there are other chemicals as well, and I'm a firm believer in that. One of the things that happened to me and was unexplainable at the time, I had zero appetite to the point where it was hard to swallow food, and I would have to force myself to eat. And even when I was eating, all my blood work would show that I wasn't absorbing nutrients really well. I ended up going on like a prescription iron pill because even the over-the-counter iron, I wasn't getting enough iron. But I lost over 113 pounds.
You got down to 116 pounds, and it's
Wow.
5'10".
It was terribly unhealthy. I mean, I literally looked like I was walking around skeleton dying. And so one of the first things that happened when I woke up is I had an appetite. Literally, right. I woke up from that surgery. So it was a weird feeling because it had been at this point, for us, almost 3 years, 2.5, 3 years. And so I woke up and immediately, I think I asked for pizza.
You did. And just to be clear, that started the healing process. That year following the surgery, from my perspective, was the hardest one, because
Mine was the best.
the stuff, the delusions were still happening, but instead of the 2 previous years when I was married to someone who was not Kelly, it was Kelly was here and then she's gone. And it
Not
could
as
happen
extreme and not
in the
lasting
middle
as
of a
long.
sentence, and I was suddenly talking to a different person, and so that was a very difficult year. But those episodes got less intense and further apart, and less intense and further apart, and almost a year to the day later, she had her last one. It lasted 2 hours. It was minor, and nothing since. It's been perfect. So that.
And
I
Dr.
always
Patel,
stress
yeah.
it starts the healing process. So a whole bunch of stuff gets immediately better, but there's
Dr.
some
Patel
stuff
did
left.
tell us
Yeah,
that
he
it
warned
would
us.
take, because you're traumatizing the brain when you're going in there. It's already traumatized and you're going in there and messing around, and it's a surgery. But he did tell us that it can take up to a year or more in some cases for some people. At that point, we had already been suffering for 3 years. It didn't matter to me
You're like, I'll
really how
take
long
it.
it
Yeah.
took.
Yeah.
Yeah, I was like, that's fine.
Oh, just a year? Good.
Yeah, just a year.
Yeah. Just
But
brain
I will
surgery?
say,
Okay.
so I did have, the episodes did happen for a little while after the surgery, but like he said, it wasn't constant. Whereas by this time, before the surgery, I believe by the time I was ready to get wheeled back. I was pretty much 24/7, a completely different person. Like it was episode didn't
It was,
end.
yeah,
It
it was
was just
just
constant.
continuous. And
So when I woke up and I was like me again, it was pretty instant.
yes.
And pretty amazing.
So you can imagine
I
the
remember
devastation when it wasn't her anymore in the back. And but I mean, we knew
Yeah.
he prepared us well.
The
So
headaches pretty much went away almost instantaneously
yeah,
too. I did have a few as I was recovering. I think at the 3 month mark, I had a pretty bad one, and that was discouraging. I was like, no, but it didn't last very long. And to this day, so it took me about a year to this day,
Yeah.
nothing. I am 100% better from all of those symptoms.
And that's
100%.
more in line with what I hear. It takes several months to a year. I
Mhm.
was weirdly lucky in that almost immediately 100% of my symptoms went away, never came back. What was a harder journey for me was the medical trauma. And to this day, 5 years later, I still get nervous going to the doctor just for a checkup or like going to the OBGYN. I'm like, what are they going to ask me? Or if I take my kid to the doctor, are they going to think I'm being a crazy parent because they're not really sick? I think not being believed and having to fight so hard is gonna
Yeah.
it has an impact and something I'm working on
we will
every
never see
day.
the medical profession the same way again.
No, and I will always be
Yeah,
leery going
exactly.
to an urgent care or an emergency room.
Hmm.
Mm,
I will always, I've got to be hurting pretty bad or about to keel over to want to do it. And I know that's not healthy. I know I need to get to a point where it's just, there are
Yeah.
certain things
right.
that should dictate when you go,
Yeah.
I shouldn't be like, no, not bad enough yet.
Well, and
But
also
it's the mistrust and the trauma.
Yeah.
there's
Yeah.
always been a certain level of trust and prestige that goes along with being a doctor, and that is just who they are. And we're kind of brought up that way. And these, they're here to help you, and they know the best. But
They are
then you go
human.
through something like this, and
Yeah.
now it's like, well, okay, each individual doctor is going to have to earn that.
Hmm.
It's there's no longer this carte blanche that we trust you because of the MD. We'll
Yes.
see, maybe.
Yeah. I do think that the majority of doctors are great people. I think the vast, vast majority are doing their best to help their patients. Even the people that are saying, nope, that's not what it is. Most of them, I think, are think that they're protecting the patient.
I
They
agree.
Sure.
they don't realize how hurtful it is to somebody who has been waiting to see them for so long, or somebody who's been suffering for so long, somebody who knows their body. They don't understand. And
Mm.
that's hopefully will change along with awareness and
That's why they take that oath. First, do no harm that you're aware of.
You're aware of.
uh,
And I also wish doctors hopefully can get to a point of just saying, I don't know.
yeah.
It's okay to not know.
I'd rather you
Yes.
not know and send me somewhere else and just be truthful. And
Yeah. We talked
we
about
talk
Dr. Lee.
about, I did have a great doctor, a neuro surgeon who did say those exact
Yeah.
words to me.
He's like,
He told me those exact
been
words.
doing it for 30 years, never saw it before, couldn't find it
I
in
would
his
respect that
research.
more,
Oh,
saying,
Oh, we
absolutely.
totally respected it.
Yes.
Yeah.
He's a great
He even
person, great
spent,
surgeon. I would trust him. If I had a brain thing going on, I would go to
I would
Dr.
go to him
Lee.
too. He took some of his patient files home the weekend that after he saw me. And because he wanted to see if maybe he just wasn't remembering a patient.
"Huh."
But he came back and called me and he said, I looked through patient records and I'm sorry, I don't have experience with this. And he had been doing it for 30 years and I just don't know. And I want to refer you out. And at the time, because the MRI did say it could be cancerous, the MRI did have a few different differentials on there because mine was calcified, but not
Uh-huh.
fully calcified. So they
Mm.
couldn't say for sure whether it was a cyst. But he wanted to make sure and do the right thing. And so he wanted to send me to a neuro-oncologist so a neuro-oncologist could look at these too, which is what he did. He said, I don't know to which cancer center do you want to go to?
Yeah, UT or MD Anderson. So off to
So
MD
we went to
Anderson
MD
we went.
Anderson. And They were not super helpful, but again, they didn't, they
They
don't
just
really deal
didn't
with
know.
these either. They just didn't know either, you know? I will say we did surprise the MD Anderson doctor though. I still see this doctor there because I do have a new small growth in my brain. It's really small and it's not in the pineal region, but we are following it with MRIs. And this last visit that I had with him, he asked me, how are my symptoms since the surgery? And we told him completely gone, everything. And he looked so shocked because
Mhm.
I think he was one of those
My
guys that
experience
didn't
too.
think that those symptoms were being caused by that cyst. So I am happy to keep seeing him if I can help him, you know, with what he may be not understanding. And he really did seem surprised. He genuinely just kind of almost jawed to the floor kind of thing, you know?
I've experienced that.
Mhm.
Any doctor that's just curious and interested to learn, they gain my respect.
Yes.
Mhm.
Okay. Well,
All right.
we've covered a lot of ground.
Yeah.
What else? Do you
Anything
have
else
anything
you
else
want
for
to
us?
add?
To close up, the one thing I would say to anyone going through this journey at the start of this journey is just don't give up. I know that sounds cliche, but you
Yes.
know yourself, you know your body, you're your own expert. Keep fighting. If you have a bad appointment, move on to the next. Keep getting opinions until you get the answer. The answer's there, it just might take a while. And get emotional support, whether that's a family friend, sibling, therapist. This is emotionally taxing and we need support through it. It's really hard to get through it alone.
That's awesome. And that's great advice.
Mhm.
And we really appreciate you being here.
And I really
Really do. Thank you
appreciate
so
what
much.
you are doing for the pineal gland community. It's
The sisters, as they
never
say.
heard that one. That's a good one.
All right, everybody, thanks so much for joining us. And we hope you join us again next week. Take care, y'all.
Bye.